Welcome back, future nurses. Today we are learning multiple sclerosis, or MS, one of the most important neuromedical surgical topics. Let's understand MS in the easiest way with mnemonics, symptoms, and nursing care. So let's begin. What is MS? Definition. Multiple sclerosis is a chronic autoimmune disorder where the body mistakenly attacks the myelin sheath, the protective covering of nerves in the brain and spinal cord. When myelin is damaged, nerve signals slow down, leading to many neurological symptoms. Simple words: body attacks its own nerves. Brain messages become slow and weak. Exact cause is unknown, but risk factors include autoimmune reaction, genetic factors, viral infections, vitamin D deficiency, cold climate, more common in females, ages 20 to 40. Remember the mnemonic D.M.P.S. D. Demyelination. Messages slow. P. Plaques form. Symptoms appear. Weakness, vision problems, numbness, etc. 1. Relapsing remitting MS, RRMS. Most common. Symptoms come, improve, come back. 2. Primary progressive MS. Symptoms slowly worsen over time. 3. Secondary progressive MS. Starts as RRMS, becomes progressive. Use mnemonic MS affects because MS affects everything. M. Muscle weakness. Sensory loss. Numbness, tingling. A. Ataxia. Balance problems. F. Fatigue. Very common. Feeling changes. Burning, pain. E. Eye problems. Blurred vision, optic neuritis. C. Cognitive issues. Memory, concentration. T. Tremors. S. Speech issues. Slurred speech. Other symptoms: difficulty walking, bladder and bowel dysfunction, mood swings, and depression. Doctors use MRI scan, shows plaques in brain and spinal cord, most accurate. Lumbar puncture, oligoclonal bands. Evoked potential test, detects slowed nerve signals. There is no permanent cure, but symptoms can be managed. Disease-modifying drugs, slow progression. Interferon beta, glatiramer acetate, fingolimod, natalizumab. Acute relapses, high-dose steroids. Symptom control, muscle relaxants, baclofen, pain meds, bladder control meds. Physical therapy improves mobility, strength, and balance. This is very important for exams and your nursing practice. Cool. Assist with mobility, prevent falls, safety measures, provide rest periods because of fatigue, monitor vision changes, help with bladder training, encourage physiotherapy exercises, teach stress reduction, prevent heat exposure, symptoms worsen with heat.